Teeth whitening. What is teeth whitening? When stain internalization takes place, these stains cannot be removed by scaling and polishing, and one has to resort to teeth whitening treatment. Teeth whitening, also known as teeth bleaching, when bleach is employed for whitening of the teeth beyond the natural shade. Bleaching solution contain hydrogen peroxide, carbamide peroxide, or sodium perborate in varying concentrations. Hydrogen peroxide is the most effective bleaching agent. The core mechanism is that hydrogen peroxide breaks down to water, oxygen ion, and oxygen-free radicals. These oxygen molecules attach with the double carbon bonds, break them down into single carbon bonds that reflect light and appear lighter in color. What causes stains? Extrinsic stains. Extrinsic tooth stains are typically caused by tobacco use, smoking, or by regularly drinking coffee, tea, wine, or cola drinks. Intrinsic stains, as aging occurs, the outermost layer of the tooth wears off and dentinal layer, which is yellowish in color, exposes itself, causing yellow teeth. Clenching or grinding of the teeth, also known as bruxism, cause micro-cracking of the teeth. These cracks readily absorb stains and cause stain internalization. Genetic disorders like amelogenesis imperfecta or dentinogenesis imperfecta, which causes abnormal formation of enamel and dentin, and hence abnormal shade of the teeth. Fluorosis of the teeth, which occurs due to hypomineralization and an excessive intake of fluoride during enamel formation. Initially, white spots are seen, which at an advanced stage causes brown staining. Dental trauma that might have caused internal resorption or necrosis of the pulpal tissue, resulting in discoloration of the tooth. What are the methods employed for teeth whitening? Basically, teeth whitening could be done by in-office bleach or at-home bleach. Before undergoing teeth whitening treatment, the doctor evaluates the patients for allergies, teeth hypersensitivity, state of the oral soft and hard tissues, etc. Shade guides are used, which varies from 2 to 7 shades. In-office bleach is carried out by a dental professional. Before starting the procedure, it is advisable to carry out scaling and polishing. Then, the gums are covered with a protective layer in order to prevent the gums from chemical burns. Followed by this, the bleaching agent is applied onto the tooth surfaces and left undisturbed for a specific time period, depending on the concentration of the bleaching agent in the gel. The upper and lower teeth could be bleached simultaneously, or upper teeth can be bleached followed by lower teeth. Bleaching agent in a gel form is recommended in order to prevent the dehydration of teeth. In some whitening procedures, bleaching gel is applied as well as laser or light is used. But according to scientific evidence shows that light or laser activation may slightly accelerate the process, but it does not significantly improve the final whitening result. The real effectiveness comes from the quality and concentration of the bleaching agent. At-home bleach. For at-home bleach, the dentist takes the impression of the upper and lower arches, custom trays are fabricated, and the patient is provided with the bleaching agent. The trays along with the bleaching solution are used. The frequency depends on the intensity of stains. Teeth whitening toothpastes, over-the-counter whitening strips and gels are also available. This method is less effective as compared to in-office whitening. What is non-vital tooth internal bleaching? When a dead tooth is discolored from the inside, internal bleaching is needed. Non-vital bleaching is a whitening procedure done for root canal-treated teeth, where the bleaching agent is placed inside the tooth pulp chamber instead of only on the outer surface. What are the contraindications of bleaching? Hypersensitive teeth, allergy to hydrogen peroxide, pregnant or lactating women, severe gum recession, untreated infection inside the gum or bone. Post-whitening instructions, post-treatment, 24 to 48 hours are crucial for achieving the best results. Do not consume food that might stain the teeth. Teeth might be sensitive for a period of 24 to 48 hours, and avoid consumption of too hot or too cold food and beverages. Maintenance. Regular flossing of the teeth. Whitening toothpaste once or twice a week. Rinse mouth after consuming food or beverages that might stain your teeth. FAQs. Question 1. How long do the results of teeth whitening last? Answer. Teeth whitening is not permanent. Most patients can expect visible brightness for about 6 to 12 months, after which gradual color regression occurs. The results of teeth whitening typically depend on individual habits and oral care. Factors affecting longevity include consumption of staining substances like coffee, tea, red wine, tobacco, and oral hygiene practices. Question 2. At what interval is it recommended to undergo professional teeth whitening? Answer. The recommended interval is usually once every 12 to 18 months. Question 3. What changes can I expect after teeth whitening? Answer. Teeth whitening primarily improve the shade of natural teeth, making them appear brighter and more aesthetically pleasing. Improvement of 2 to 6 shades lighter varies per individual. Limitations. Does not change the color of crowns, veneers, or fillings. Realistic expectation. Whitening enhances brightness but does not guarantee perfect white teeth. The final result depends on the original tooth color, type of stains, and enamel quality. Question 4. Is whitening toothpaste effective? Answer. Whitening toothpaste provides very limited whitening effects compared to professional treatments. It is ideal for maintaining results after professional whitening. As teeth whitening has its pros and cons, do not undergo the treatment without consulting a licensed and skilled dental professional. Contact us. Teeth Care Center, Dental Hospital, 2nd floor, Pushback 66, near Samshwar Jain Temple, 132 feet Ring Road, Satellite, Ahmedabad, India 380015. Call +9 1787 878 3384 +91 937 778 3384 www.teethcarecenter.com.